Well, see, this particular virus has been there, and we are very much aware of its presence since 2001. And there are a few reports that this virus has been there in the community since the 1950s. But probably the nomenclature, the name has been given late in 2000 after the virus got discovered from Netherlands. And so far as global incidence is concerned, it is still localized in the South Asia and Southeast Asian countries, including ours, that is India. And the initial reports came from China, particularly the northern part of China, that is the districts around Beijing. And as you know, that this is a respiratory virus that can affect the upper as well as the lower airways, and predominantly affecting children who are aged less than equal to 12 years, and infants, toddlers, they are getting affected. Although it can affect all the age groups, but still, as I have been telling from all the platforms, that still there is no need to panic. And as far as the distribution is concerned, it's mainly South Asia and Southeast Asia, countries in and around China, and that is the reports that we have got so far with us now. Absolutely not. These are two different viruses. I'll just like to give you a few details about this particular virus. This virus belongs to the family of pneumoviridae, and the other virus which comes from the same family is the respiratory syncytial virus, that is the RSV. Now both these viruses are known to affect children. And COVID virus, which was the COVID-19 virus, as far as the nomenclature goes, it was a novel virus. It was absolutely a new virus, and we came to know about it in 2019, and from that it got its name. So SARS-CoV-2 was a different virus, and this is an old virus. That was a new virus. Its virulence, its transmissibility was absolutely different from this one. And this is much lower down the order as far as virulence is concerned. And so we keep telling people that please don't get so much worried, so much panicked, because majority of you, it will be just like flu-like symptoms. And if your immunity is well, it is boosted up properly, then your immunity is good enough to take care of this virus, which was not the case for COVID-19. So COVID-19 was a different virus, and this is a different virus. That was a novel virus, and this is something that has been there for quite some time now. So these two viruses are absolutely different, and that is why no need to panic at all. This is an old virus, and we will be able to manage it properly. Absolutely not, because we are not in a state to go for a lockdown now. We have to be alert, that's all. And people have to have that surveillance, and all the concerned bodies and policymakers are looking at it. And as you all know that our Union Health Minister Shri JP Nadda ji, he has also given a statement that there is no need to panic at this moment. There is no question of going for a lockdown immediately, because things are still under control, and we are keeping a watch on how this situation is developing. So there is no need to panic at all, and there is no question of lockdown now. See, there are a few things, there are certain do's and don'ts, and we know all these since the COVID times, that you have to have a proper hand hygiene, you have to wear masks, and you have to avoid contact with people who are symptomatic, who are having all those upper respiratory symptoms of maybe fever, running, or stuffy nose, or they are sneezing or coughing. You have to maintain a certain distance from these people. Avoid using the same utensils, like in the if it is there in the household, if some person is infected in the household. And your cough and sneeze etiquette, that has to be maintained properly. And have an immune enhancing diet. You have to boost up your immunity. So these are the certain do's and don'ts. If you do these things, then your immunity is good enough to get rid of this virus.